In our paper, we present design verification of a stress management app for healthcare workers in their workplaces to help them handle stress during COVID-19 and beyond. So healthcare workers are susceptible to a number of stressors due to the nature of their frontline duties, because they work very closely with the patients and with the crisis. They experience clinically significant depression, anxiety, insomnia, and other mental health issues. And it was found that during COVID-19, these mental health issues exacerbated among the healthcare workers. And ironically and unfortunately, there remains a paucity of solutions that can address mental health needs of healthcare workers. So based on this need, we conducted some studies with healthcare workers that led to the identification of some sources of stress, challenges that healthcare workers face with managing stress, and coping strategies that they used for managing their stress. So this study has been reported in another publication. In this paper, we present our design proposal that was based on the findings of our earlier study. So I will show you the prototype app that we came up with based on the needs of the healthcare workers that we identified in our study.
This is the initial screen for a stress-free app. From this screen, the user can create the account and the user can log into the app. So whenever the user is logging, the user can see his duty status. Right now, the duty status is set to on duty for demonstration purposes. So for the main 4 modules, there are 4 buttons here. Also, there is a program menu to access the subsidiary options. So when we click the assign task button, we are getting 2 sub-modules. One is the pending task, another one is task history. So from the task history, the user can see previous completed tasks with their perceived stress level and the time and date. In the pending tasks module, there are the tasks that are assigned to him currently. So if the task is completed, then the user can click on a task and there will be an option to select the perceived stress level. So the stress level can be reported to his supervisor. Okay. So if we go back to the home screen, now we can see the My Notifications module. Here, all the upcoming notifications are available. So through this button, the user can clear all the notifications, and to this button, the user can go to the notification settings menu. From these settings, the user can select the preferable time to go for sleeping or preferable time to having lunch, or when he would like to join the yoga group. Okay. So when we click on the Get Help module, we are actually getting 2 sub-modules. So one is iChatbot, another one is peer chat. So iChatbot is actually the information chatbot or intelligent chatbot, which will provide initial guidance to a healthcare worker for deciding some actions for the patients. So for demonstration purposes, we are using a chat video here. So let's see. So here the bot is asking some information about the problem the health worker is facing right now. So the health worker is actually facing problem with the patient's breathing. So the chatbot is asking about the patient's heart rate and oxygen saturation and so on. If the chatbot is unable to deliver a decision, then the chatbot will forward the chat history to the available peers. Here the peers are actually the other healthcare workers like doctor, nurses. So we get back to peer chat. So here we are also showing another demonstration video. So we can see here already the chatting history is available. So right now another doctor is suggesting some advice to check the blood pressure of the patient, and later another senior nurse is also guiding to put oxygen mask to a patient and wait for a few minutes. The final main module of stress-free is wellness check. So inside wellness check, you can find two sub-modules. One is stress monitor, another one is infection check. Using stress monitor, the app will decide whether the stress level is safe or unsafe for the healthcare worker. So the app is connected to the user's smartwatch. So whenever we click on the button, the app is syncing the physiological signal from the healthcare worker, and it is showing that the healthcare worker's stress level is right now high. So whenever we are going to infection check, actually the infection check module is for diagnosing in COVID-19 infection of the user. Here we also employed another chatbot for demonstration purposes. Here is another video. The chatbot will ask some preliminary question to the healthcare worker to decide whether he or she needs to go for isolation or go for a COVID test. So the health worker is diagnosed with COVID-19. Actually, the chatbot is suspecting COVID-19. That's why the app makes the healthcare worker relieving from the duty. So right now the duty state is you are released from duty.
So the goal of our design verification study was to find out whether this app will be useful for the healthcare workers. So to answer these questions, our three specific research questions were: which features participants would want to use for stress management, and what is their feedback on the proposed design? And finally, we did a quantitative data collection of how many participants are finding the app useful and how many are willing to use it. So our method was a survey. We created a survey, and we used purposive sampling method to recruit participants. Participants were sent a survey link and a prototype link. Participants explored each component of the app, and then they came back to the survey to answer the questions. In the survey, participants were asked to vote for either removing, including, or modifying each component. They then reported anticipated benefits of each feature and any concerns that they were seeing in using it, and they also were provided feedback on how to improve each feature. And then finally, participants rated their willingness to use the app and their perception of the app's usefulness on a Likert scale. We ended up recruiting about 22 healthcare workers that included nurses, nurse assistants, physician assistants who were working in hospital or primary care settings. The ages of the participants ranged from 18 to 60 years old, with a mean age of 35. And participants had about 1 to 35 years of workplace experience, and with a mean age of 9.6. Two participants were students or interns, and they were working in emergency departments. In terms of their voting, we can see this is how the distribution looked like. The most participants voted for the inclusion and modification of the stress monitor. Only one participant thought that it should be removed. My notifications feature was also found to be very acceptable by the participants, and most of them voted to either include it or make some modifications to it. Peer chat was also found to be very favorable, and so was the assigned task. But iChatbot and infection check received a high number of removal votes. And next, we will look at participants' feedback to understand why they voted these features in this way. So we conducted a thematic analysis of the responses, and we present a brief narrative of what we found. So first of all, for the assigned tasks feature, participants thought that this feature would really help them manage their tasks and time, and it has the potential to make them more productive. But participants did not agree that the assigned tasks should be about managing patient-related tasks. They thought that the EMR is more useful for that purpose. So they asked us to pivot this feature on their tasks, on healthcare workers' tasks, as opposed to including patients' tasks in it. The next feature was iChatbot. And participants thought that the iChatbot could help them manage their stress, but they were worried that the chatbot might not be fast enough in the emergency room or in a situation when the patient was requiring urgent care. They also thought that this feature would require considerable customization to be useful in their workplaces. And some participants suggested that we replace this feature with a healthcare provider link. So if healthcare workers are experiencing stress, they could immediately contact the professionals and get some help. The next feature was peer chat. And this feature received a high number of votes for inclusion. Participants were very excited to see that they will be able to contact their more expert peers and ask questions. But they thought that the peer chat will be more useful if it allowed them to ask questions anonymously, but they wanted to know the identity of the responders. And they did not think that this peer chat should be used to discuss patient problems for privacy purposes. They didn't want to use this feature for that reason. The next feature is the infection check, which was about, gave healthcare workers the ability to see whether they have COVID-19 related symptoms. Participants thought that this feature will be very useful and it will help them lower their stress levels, because they won't be worried all the time that they have COVID-19. But they mentioned that they are already using something very similar that has been provided by their work, and they thought that either they are going to use the one that their workplace has asked them to use, or they will use the one that's in the app. So they didn't want to use both of them. And that was the main reason they wanted us to remove it. But they thought that if their workplaces is going to just replace it, the existing one with the one in the app, then they will be okay with using this feature. Stress monitor was found to be favorable, and participants thought that it will be very useful to them because it will increase their awareness about their health. And just by having this awareness, they will be motivated to take better care of themselves. And participants were also excited about the fact that they won't have to do any manual data entry. So they really like the autonomous nature of this feature. And they thought that it's doing very well to augment the existing capabilities of these smartwatches, because smartwatches, they don't necessarily provide any suggestions about coping with stress, but the stress monitor is filling this gap. One concern that participants had about this feature was that it would sharing their health data with their supervisors or their workplaces might not be in their best interest. They were worried that their workplaces might end up using this information against them in the long run. So this issue was raised by some participants. Last feature that participants found really useful and wanted to include was the My Notifications feature. And participants mentioned that the alerts and notifications could be very useful in the healthcare settings, but they were worried that it might lead to alarm fatigue because they are already exposed to a lot of different kinds of alerts in the healthcare environment. So they requested that we pivot these notifications on just providing them with some coping strategies and giving them the ability to personalize this feature. So the notifications that they are receiving are just something that they are interested in receiving. And they requested that we include three different kinds of notifications. One that would increase the awareness about their health status, another one that would promote or encourage them to do healthy activities, and the third, they said that they actually wanted to see some suggestions for healthy activities. Finally, we wanted to just get an overall view of what participants felt about the usefulness of this app. So about 12 participants thought that the app is useful or very useful. 7 were neutral, and they mainly were neutral because they were not sure whether their workplace will allow them to use it. But they said they will use it if their workplaces allow it. In terms of their willingness to use it, again, it was the same, very similar situation. About 13 participants were willing or very willing to use the app, and 4 participants were neutral because they were waiting to see if their workplaces will allow them to use such an app at work. So our conclusions are that, first of all, the peer-to-peer support groups with specific design considerations such as anonymity and credibility are desired by healthcare workers for stress management. Secondly, health nudges that increase awareness about a problem and promote and facilitate behaviors that can lead to lowering of stress are desired by healthcare workers. And they are interested in intelligent chatbots, but they want them to be efficient and robust to be useful in healthcare settings. And this is it. And now we are working on developing this stress-free app with modifications, and we are going to deploy it and test it out with the healthcare workers. Thank you.